Headaches. I would say 80% of the public will have back problems at some point in their lives, and many more have headaches. Whether it's what's known as the normal everyday headache, migraine headaches, it doesn't matter. We're lumping them all into one category, headaches, and let's pick them apart and discuss the various causes of them. So primary headache syndromes, tension type headaches, migraine headaches, trigeminal neuralgia, which really isn't a headache, it's a headache of the face, I should say. Severe pain in the face, as a matter of fact, people want to kill themselves when they have severe trigeminal neuralgia. Atypical facial pain, cluster headache. Cluster headache is really a form of migraine headache that occurs around the eyes usually, and benign paroxysmal headaches, which is the kind of headache where you're walking along, you feel absolutely fine, and then bang, it just hits you. You get this severe headache that drops you to your knees. So tension type is the most common. About 69% of all headaches result in tension headaches. Episodic or chronic, you can have them over a period of time, for months at a time or every single day, or you can have it chronic where it just happens periodically but over many, many years. Gradual onset radiates forwards from the back of the head to the front of the head usually, bilateral on both sides. It's dull, tight, almost like a band, like they say, you know, I feel like I'm being squeezed, like my head is in a vice. Less in the morning, but the pain increases as the day goes on, and you'll see why in a little while. And there's throbbing, no accompanying a nerve type of pain where you get other types of symptoms, throbbing, sensitivity to light, sound, or movement. Very, very sensitive to those things. Pathophysiology, physiology means function, patho means pathology, so there's some type of a problem with function of the body. Primary disorder of the central nervous system, pain modulation, where the body is just not producing the proper hormones or substances or neurotransmitters to inhibit pain. Precipitating factors, what causes stress, usually occurs in the afternoon after a long, stressful day, of course at work, or after you're at examination if you're a student. Sleep deprivation, definitely if you go a period of time, a few days without much sleep, that can cause headaches. Uncomfortable, stressful position and bad posture, very, very common. Irregular meal time, you're hungry. When you get hungry, very hungry, not just for a couple hours, but very hungry, you can get headaches. Eye strain, if you're constantly reading, looking at a computer, your eyes can become strained and that can result in headaches. Caffeine withdrawal, if you're used to drinking coffee and you suddenly stop drinking it, or soda, that can cause a form of withdrawal and result in a headache. And dehydration, if your body is dehydrated, then it screws up your electrolyte water balance, and that can cause headaches. So the theories: muscle tension around the head and the neck, that can result in headaches. Malfunctioning pain filter located in the brainstem. That's what I was talking about, the modulation before. And that will also result in headaches. The brain misinterprets the information and it interprets it more as pain. Management, the typical medical management, different medications which only just relieve the pain temporarily. They don't get to the cause of the problem, and that's my biggest complaint as far as medications are concerned. Relaxation will certainly help, especially if it's due to muscle tension. And chronic, they will put you on amitriptyline for chronic type of headaches. Migraines, the second most common, about 16% of headaches. 15% of women will get them, 6% of men. Severe episodic, unilateral, it's usually on one side of the head. Throbbing pain, nausea, vomiting, you will usually get nausea and vomiting, or at least nausea. Sensitivity to light, sound, movement, any type of movement, your movement as far as your own body is concerned, but you like to be in a dark room at that point. You don't want any light. Genetic predisposition, very common in very common that it's genetic, that it runs in families, and it's passed down from generation to generation. So there's a symptom triad: paroxysmal headache, a sudden headache, nausea, and or vomiting. You don't have to vomit. Sometimes when you vomit, it will relieve the headache to some extent. You get an aura, or what they call focal neurological event, 20 to 25% of the time. As far as the aura is concerned, you might see stars in front of your eyes, you might see dots, you might see different lights, and this is usually a sign that the headache is coming. Flashing lights, severally zigzag lines moving across the visual field, and that will, sometimes it results in a portion of a loss of your vision. Okay, just a portion of your vision is affected. Sometimes it's auditory. You'll hear sounds before you get the headache. Olfactory, you'll get a weird smell, and you know that when you smell that, whatever smell it is, you will get the headache. Gustatory, taste, you'll get some type of a taste, a metallic taste in your mouth, and then you know that it is coming. And hallucinations, you actually start hallucinating in some people. It's rare, but it does happen. Sensory auras spreading from the front of tingling and numbness from one body part to another. Without auras, you just get the sudden headache, vomiting, plus or minus the nausea, and no auras. Okay. At least two of the following in order to be diagnosed with migraines. You have unilateral one-sided pain versus the other side, a throbbing type of pain. It's aggravated by movement, which most headaches are anyway, and moderate or severe intensity. Unfortunately, people just think if I have a severe headache, it's automatically a migraine, and that's not the case. And then you have two of these and then one of these, the nausea and or vomiting, and then photophobias, those auras, those you see things in front of your eyes, spots or whatever the case may be. Phonophobia, you would hear things. Triggers. Okay, what can trigger the migraine headaches? Flashing lights, loud sounds, strong odors, stress, hunger, fatigue, alcohol, certain foods like cheese, chocolate, caffeine will trigger it. MSG, okay, heavily used in Chinese food. Oral contraceptives can trigger headaches, menopause, and oral contraceptives sometimes will even relieve migraine headaches. Pregnancy, menstruation, all these things are triggers as far as migraines are concerned. Dysfunction of ion channels, I don't want to get too technical, it has to do with the sodium-potassium balance inside and outside of the nerves, and if that balance is off, and that's why dehydration can result in it. So it'll cause depolarization, or in other words, activation of the impulses within the nerves. And that can cause a release of inflammatory substances, and the inflammatory substances will irritate the cranial nerve roots, the nerves in your head, but also the nerves in your neck as well. And then you get constriction of blood vessels in the brain and dilation. So you get the blood vessels get smaller in the deeper portions of the brain, and then on the outer portions towards the scalp, they dilate. And when they dilate, that means the blood vessels get bigger, and when they get bigger, what happens? Well, that's where you start feeling that throbbing or pounding, because you're actually feeling the blood pulsating through your blood vessels. So it's really more of a, very often it's a neurovascular problem. We have irritation of the nerves, and the nerves control the size of the blood vessels, and when the blood vessels should be constricting, they're dilating, and that's what's causing the headaches, the pain, the throbbing, and so forth. Acute attack, again, medically, aspirin, okay, different forms of paracetamol, severe attack, they have another drug for that, frequent attacks, other drugs. Again, it's all geared towards relief of the symptoms. Headaches, sinus type of headaches, pain is usually behind the forehead or behind the cheekbones, because you have frontal sinuses here, maxillary sinuses here, ethmoidal sinuses just above the nose. Cluster type of headaches, pain is in and around one eye, usually cluster, so they'll occur for a few minutes and they disappear for a while and they come back, occur for a few minutes and they appear. Basically the headaches are in clusters. Tension headache, pain is like a band squeezing the head, and the migraines, pain, nausea, and visual changes are typical of the classic form of migraines. So what can we do about it? Well, chiropractic should be the first line of defense as far as headaches are concerned. Treating headaches and relieving, more importantly, relieving headaches. Amitriptyline is not an answer. Going on that. Furanol, going on Furanol for the rest of your life is not an answer to the headaches. Yes, it may help to prevent it, but you'd rather prevent it naturally. And how do we do that? Through chiropractic care. This is the #1 cause of headaches. These are 4 bones here. The person's facing to your left. The first bone, the third, and the fourth are in their proper alignment, but the second bone has shifted backwards and downwards. Look at this size of this nerve, look at the size of this nerve, pretty thick and healthy. But this nerve in the middle is atrophied, it's much smaller, and that's because the bone is out of place and it's pinching or irritating the nerve. So subluxations are something that are overlooked, and the reason why they're overlooked is because of the fact that they don't always cause symptoms. Okay, that's a problem, because if they cause symptoms, then people would have them corrected immediately. They cause just about all tension type of headaches. They cause the majority of migraine headaches, and they interfere with nerve flow. Okay, the nerve flow that the nerves that are supplying the head, the muscles in the head, the muscles in the neck, and so forth. And then they interfere with the nerve flow going to the blood vessels. And when they're affecting the nerves that are going to the blood vessels, then that's where they're causing the blood vessels to dilate when they should be constricted, or to constrict when they should be dilated. And that can cause migraine headaches. So therefore, subluxations need to be corrected. How do we correct them? By chiropractors using their hands. We gently, very gently move the bones back in their proper position to take the pressure off of these nerves. When we push the bone back into place, it takes the pressure off the nerves, then it reduces the inflammation of the nerves, and therefore the nerves can function better. When the nerves function better, they're going to reduce the number of headaches and the intensity of the headaches. So therefore the subluxations have to be corrected, and this is how you can relieve headaches and prevent them. And that's really what I love about chiropractic. As a chiropractic neurologist, I deal with the nerves specifically, and there are so many problems that can develop throughout the body as a result of nerve irritation, and especially when it comes to the different forms of headaches. So if you have headaches, or if you know people who have had headaches, give us a call. It doesn't hurt to find out if it's something that we can help you with. My telephone number is 941-365-6400. Thank you for viewing this video, and I will see you on the next video.